I'm with Chiemi Hayashi and Bernd Sikken, the authors of the report Transforming Pensions and Healthcare in a Rapidly Aging World. First question to you, Chiemi. What is the aim of the report and what are the key insights?
The aim of the report is to address the question of how to improve financing, access and quality of retirement and healthcare provisioning in the long-term future. The key insights in this report is that the window of opportunity is rapidly closing. The demographic shift is evident not just in the developed countries but also in the developing countries, especially with a long-term perspective. With the current crisis, the stretched resources are very in high demand and competition. So now is more than ever the time to address this question and take action. The second point is that by collaborating with the other key stakeholders, this could bring a fundamental change in how we address the question of aging societies. The third point is that by focusing on common interests, this brings a whole array of new opportunities and approaches, rather than focusing on this effort on an individual silo basis. And these ideas have been crystallized in our 11 promising strategic options that in our report, Transforming Pensions and Healthcare in a Rapidly Aging World.
Bernd, can you tell us more about these strategic options?
So we identified a broad range of strategic options, of which we highlight 11 in this report. And let me give you a number of examples. So the first one is promoting work for all the cohorts. The second one is shifting to more patient-centered healthcare systems. And the last example would be providing financial education and investment advice. All these strategic options require the concerted effort of different stakeholders, so financial institutions, healthcare providers, governments, employers and individuals. In this project, we've engaged over 300 leaders from those different communities.
Chiemi, could you give us an example of a strategic option and how different stakeholders can work together?
One of the interesting strategic options is called Shifting Delivery of Healthcare to a Patient-Centered System. This is interesting because it is transformational in the way that we approach it, the mindset and behavior. So for example, if you're a healthcare industry, you will need to start looking into prevention rather than curative care. And if you're a financial services industry, you would start to look at the output-oriented reward system rather than the input-oriented reward system. And if you're a government, you will need to look into a healthcare system that focuses on health rather than curing the diseases. And as an individual, we'll need to be informed and aware and become an active patient rather than a passive patient. So with a concerted effort, this option enables the healthcare provision to be much better, cheaper, and more accessible.
Final question to you, Bernd. How can the public sector and the private sector use the report?
Okay. We hope that this report really serves as a source of inspiration and hopefully as a manifest for action. So if you're an individual and you're concerned about your old age future, or if you're an employer and thinking about collaborating with financial institutions, healthcare providers, governments in creating more compelling employee benefits, or finally, when you're a government and thinking about alternative ways to secure the future of your elderly citizens, we suggest read this report.
Thank you very much.